One of the major factors for causing stroke, or that stroke is a complication of is untreated hypertension. Most of the times before the main stroke comes, there's always like mini stroke from time to time, whereby it serves as a warning sign. You know, when you like want to listen to a music and you get a snippet before they release the music, or you watch a trailer before you watch a movie. So that's how the mini stroke is like to stroke. There's an acronym that we normally use to educate people about stroke, and the acronym is called FAST.
Can you imagine working all your service years and then you retire and you are using all your money to care for one illness that was end as a result of ignorance?
Hello guys, welcome to our podcast Vital Signs. My name is Taiwo. I'm a registered nurse and a public health advocate, and with me is
Oyinda, and I am also a registered nurse and a public health advocate.
And today, from last time, as most of you that started listening to the first episode, we said we'll be talking about stroke today, or as the medical people call it, cerebrovascular accident. We'll be talking about what stroke is and how to recognize stroke, what to do when you see the signs we talk about, what to do and the likes. So stroke, you've heard about stroke. What's stroke?
Let us give our people some assignment before we start. In Yoruba, stroke is aisoropa. Maybe people can make comments and then tell us what stroke is called in your own native language. Stroke is the situation whereby an individual loses the function of some part of the brain, and what could result into this is as a result of inadequate blood supply, or when the artery supplying the brain burst, causing what we call aneurysm. And the inadequate supply of blood to the brain causing stroke is called what we call the ischemia. Ischemia meaning that there is no enough oxygen being supplied through the blood that is carried within the arteries to the brain. And when there is no enough oxygen, remember, even our lungs, when we don't have enough oxygen to breathe, it collapses. Same thing with the brain, it collapses. And it just shuts down, and there is clot which shuts down the part of the brain that is affected. And such an individual loses function of either the arms or the legs. Could either be all of them, or one off or two off. It could be one arm and one leg. But then, like I explained in the definition of the stroke, we have identified two types of stroke, which is the ischemic stroke and the hemorrhagic stroke. Ischemia, where there is no enough oxygen, resulting in the stroke, and the hemorrhagic, from the word hemorrhage, which is bleeding in the brain. Let us use the pipeline again, which is my favorite example.
Are you sure you're supposed to be a nurse or a plumber?
Maybe I love the job so much. I respect people who are plumbers so much. So let us use the pipeline again. Remember when I talked about earlier on our podcast about hypertension, I talked about high pressure within the pipeline, gushing of water within the pipeline. At some point, there's just no enough resistance. The pressure is too much for the pipeline to withstand, and everything just bursts, which causes leakage everywhere. And then in this case, the leakage is within the brain, not outside. We're not seeing it. That is why such a person just loses function of whatever part of the artery is affected. So now again for the ischemia, what results into oxygen? We think oxygen, because many people think oxygen is just something we breathe in. But then the interesting part is this oxygen is being carried everywhere, to our hair, to our fingernails, everywhere within the body. So now imagine when we talked about arteries earlier, thinning out, causing high blood pressure. So in this case, it could be either due to fat or some other factors. So the artery is thinned out, there is just small amount of blood passing through. And the medically read people would say anything that is not viscous, maybe like molecule, like the oxygen being carried, there is no enough room for this oxygen to move, and it's causing ischemia. So ischemia is when there is not enough oxygen, like we've said. Now I am going to face Taiwo, because I know we've talked about the two commonest stroke. Then now I think should be another one.
Yes.
that is not commonly known by people, where people say, that man, he had stroke last week and he survived it. What kind of stroke is that one?
Yeah, we've got something we call mini stroke, or the medical term is transient ischemic attack, whereby it's a mini stroke that a lot of people might survive, that will be like, oh, he has stroke and he survived. And it might not be the full-blown stroke. There are some people that recover from the actual full-blown stroke, but most of the times before the main stroke comes, there's always like mini stroke from time to time, whereby it serves as a warning sign. You know, when you like want to listen to a music and you get a snippet before they release the music, or you watch a trailer before you watch a movie. So that's how the mini stroke is like to stroke. And like, you know, we usually do on this podcast. Before I forget, Oyinda spoke about when stroke happens, what happens to the brain?
Quickly. Imagine something bursting. It is quick.
Yeah. And the brain needs oxygen. The brain is like a foodie. Let me use that term. It's like a foodie, whereby it's constantly, you people might think, oh, because it's not a muscle, it uses a lot of nutrient actually. It uses a lot of glucose, a lot of oxygen to like make sure it functions properly, because it controls everything in the body.
Of course.
So once there's probably like no adequate blood supply, there are a lot of things that you recognize that happens to the person, and it could lead to paralysis, speech impairment, memory loss, or even people die sometimes.
There's something we need to let people at home know about stroke. You know, hypertension is something that can build over the years. Unlike stroke, medically and then worldwidely, I think it is recognized that if an individual does not present at the hospital for first aid treatment or for chronically aggressive medical care within 6 hours, such a person is going to lose his or her life. And it does not even matter if it is TIA, the transient ischemic attack. So because if oxygen is not getting so much to one part of the brain and you don't supply enough, of course, eventually everything would cut off. And if there is no immediate urgent care, that's death. And we have to remember everything here is tailored to Nigeria, where we do not even have emergency or urgent care. There is no emergency, there is no ambulance anywhere. And then people do not even recognize the signs and the symptoms of stroke.
Like, you know, we do, like we did in our previous episode, whereby we talk about the numbers and like the research and scientific findings but now we'll be talking about strokes.
Scientific reports, the researches and studies that have been done about stroke in Nigeria. And we should be actually worried, because the last one, the most recent, should be as of 2021, and now it's 4 years after. We've not gotten anything. As advocates that we are, I do believe someday maybe somebody like us, or people who just feel the need to go into doing some researches, would go back.
It's not just two people sitting on a couch and just talking rubbish. Everything we are talking about are scientific based, and we've got rationale. And as of 2019, there was a study talking about the prevalence of stroke survivors in Nigeria. It's 6.7 per 1,000 people, with higher rates in men and rural areas. You think when you say 6.7 people in 1,000 people, it's actually really small though. Like in the stroke survivors now, that's what we are talking about, the stroke survivor. That's quite a lot of people dying from stroke. So if like now we've got 1,000 people, just probably let's say 6.7, or let's just say 7 people are surviving, and the rest of 993 people dying.
Like 3% of population of people dying from stroke. And I do not want to go into examples yet, but because we are doing studies, and then one thing with data is data can be collected anywhere. Data can be collected directly or indirectly, like subjective and objective. Now we see online of people in rural environments, like I saw one video of an elderly man being like dragged through the floor because he lost activity of his both legs, and that is basically stroke. And then this person was still being dragged, being treated poorly. You know, he survived from the initial stroke. Now the complications that were left behind that should be treated really aggressively for him to regain his total function, but nothing was neglected. I do believe part of this 93% of populace that die from as a result of stroke is because of poor treatment and then poor recovery. Because people that die immediately, and there are some people that just survived it, but in the long run, they don't get enough rehabilitation back to normal health. And then with this study of 2019, if we compare this to the study of 2012 that was done, remember the population then, well, I think was around 4% now compared to 2019. We should be worried because instead of, we are doing studies, and the purpose of studies is for people to be aware, for the government to do something to prevent, for prevalence activity, but then nothing is happening. Instead of us getting reductions, instead we got an increment. And now if you talk about stroke accounting up to 60% of neurological damage, neurological has to do with anything of the brain and nerves. So functions of the body, brain control the function, but the brain alone does not work. There are nerves all around our body that helps with coordinations and functions. And then death that results from those kind of diseases, they result to 60% from only stroke as of 2019. And then in 2012, there was like 12 decrease that was reported by studies conducted in Nigeria. And then, we talked about so many studies when we were discussing the hypertension, Taiwo, but I am really sad to let people know that there is limited amount of studies conducted on stroke. And that is not to say people like us are not interested to do more, but who is to support? And this is where advocacy comes in. Advocacy is not just to treat people and to educate people, but even to educate the government. Do you want to talk more about the researches amongst the young people? Because it is really alarming now.
Yeah, like you said, passionately about Bosnia. You might not think, it's serious, but if you take Nigeria is over 250 million. Last they did census, which I think is more than that.
Almost now 2 decades.
So I think if you take the percentage of people losing their life, that's quite high and alarming. And we've got there's another research that shows 30 days fatality rates in people that have got stroke, where they present to the hospital really late when the stroke happens. They have 40%. So 40% of people out of the entire 100%, 40% of them die within 30 days.
Because they present late.
Because it's late. And it's something about stroke, my colleague said earlier, is about early presentation. Stroke, anytime you remember stroke, early presentation. We'll get more and more to let you know about signs to look out for when you see someone experiencing stroke later. And
then I think before we move ahead, there is this increasing affectation among the younger generations, where 20% of stroke were found to be between the ages of 80 and then 50 years old. I know of a very dear family friend then, I think it was in his 40s then, when he had something stroke, because then I did not know. I was talking about 2011, I was still in high school then. So this man presented with just shifting of the mouth to the side. But our people, he didn't even go to the hospital. What he thought was, Shayin, like it's the word of the village people. He just went traditional. Well, the thing went away. But remember, from our definition of the transient ischemic attack, that was a clear presentation of that. In this case, he lost no function in any part of the limbs. He was still doing his normal activity. The only symptom he saw was the shifting of the mouth to the side. I was frightening to me then too, because I did not know.
Yeah.
But the best thing I think should have been going to the hospital, but it was the man. But I think now this is where I get a little bit confident, because earlier on you were really certain that more women were being diagnosed with hypertension. Now, the research in 2019 and even 2012 said more men they are diagnosed with stroke and died from stroke than women. That is to tell us that men are not doing the curative and preventive medicine of preventing all the causes that we'll talk in a minute about.
Complications.
stroke, and as a result of complications of high blood pressure and some other factors.
Yeah.
So
With the study you were talking about,
Yeah.
that the number of young people having stroke or hypertension leading to stroke,
Yeah.
is, you know, what is interesting in all of this is what has been uptrending or trending up together with these cardiovascular or cerebrovascular events is substance abuse, smoking. Everybody thinks it's fashionable smoking now, and this has led to more complications whereby the hypertension, a lot of young people, they don't know they have hypertension. When they present with stroke, they are almost gone or dead. So this substance abuse has been going up without being checked appropriately, and the health complications has also been going up. And most people like do all these things thinking they live like Nigeria has got the best healthcare system to fall back on. We do have a lot of, don't get me wrong, we do have one of the what's the name, leading teaching facilities in the country.
Yeah.
But when it comes to application, there's no modern technologies to help people. When you have people that they've got bright minds, this is another thing we're talking
on the
about.
bright minds, yeah.
Yeah, we've got bright minds, but you don't give them equipment to practice effectively. This is leading to frustration and them leaving the country.
On the bright mind, before we move on, you know, there was another study that was carried out in Enugu as of 2021 amongst even the medical students. But as a medical student, you should know about stroke, you should know about hypertension, the epidemiology, and then causes, risk factors, and everything. And I am not surprised, but you may be surprised that the age range of 18 to 25 population that were used as the test study were with hypertension. Most of them into even second stage of hypertension, and some of them into pre-hypertensive state.
Yeah.
And then when you look at it, they weren't even doing any curative or preventive care, no routine screening. They just found out naturally because they accepted to be a test study. So now, I mean, it calls for concern, and that is why we are actually talking about this. And another thing, when you talked about substance abuse, there is these connotations going around that medical students use more of this substance abuse to stay active, and because the course is very challenging. Well, maybe it is right, maybe it is not. I don't have any personal research or personal experience to confirm this. But let's look about other people in other fields of study. So if it is believed, if some certain group of people believe that studies could cause that very high pressure on young adults to go into substance abuse, to keep themselves alert, to keep themselves on the path of study. No, we can't blame them, because in a way they are trying to get some kind of sustenance. They are trying to better their life in a way, whereas they are causing another damage on the other hand.
Things you need to look out for when you suspect someone is having a stroke, or probably someone is having a strange signs or symptoms that you've never seen before. And there's an acronym that we normally use to educate people about stroke. And because we said about stroke is early presentation, is based on time of presentation. So the acronym is called FAST.
Fast as in you run fast, you eat fast, you talk fast. Fast, F-A-S-T, fast.
The first thing is facial drilling. Most people, like you said about your uncle, the facial drilling, like when they recognize this is still the early stage. Instead of people looking and panicking, rather than you panicking, people say knowledge is power. So like now that you're listening to us, you are gaining knowledge and educating yourself. If you see someone with facial drilling that is happening in that right moment,
or it has even happened in the past, they need to do checkup again.
Yeah, they need to do checkup. So you see the facial drilling, the face drilling to one side, or like the eyes is pulled down, like the muzzle on his side is being pulled down and is looking off to their normal look. That's one of the first signs. That's F. The A is side weakness, probably their arms and leg on one side. There's weakness, they can't lift it, they can't move it. That's another sign for you to recognize early. Then the third thing, which is
that will be the speech difficulty. I mean, even if they don't have the facial dropping, if they are finding it difficult to talk, somebody that talks really beautifully, that talks without any problem, and suddenly they find it difficult to talk, their tongue is slurred or twisted, or they just find it difficult to make a speech, just know, everything we do is controlled by the brain, where we have the cortex everywhere. So one part of the brain that controls the vital part of speech has been affected due to either the ischemia or the hemorrhage, and that needs to be checked immediately. And then the last one, the T, we've talked about the F, which is the facial dropping. We've talked about the A, which is arm weakness. It could either be one of the arms. And then we've talked about the S, which is speech difficulty. Lastly is T, which is our time. Again, time is really crucial. Well, in this part of the world, we do not have any number to call. I believe Lagos State has a number for emergency call.
Nigeria actually has.
Did it work?
No.
I mean, I'm not sure, but then we've got, many of us have our cars. If we as a family, if we don't have any car, it is very suggested that you borrow car from that your neighbor that you don't talk to, or that your neighbor that you always good morning, or that your community leader who has the car, who is the only one with the car in your community. The person just needs to be taken to the hospital to see a medical doctor, not a quack nurse. Either people they recognize as quack in male figure doctor, in female figure nurses, or even the TBAs. People would do funny things to save the life of our loved ones. But in this case, the best place is the hospital, and not your private hospital. This is something you take to the tertiary hospital for immediate admission.
Yeah, because most of the private hospitals, they are not equipped to deal with this, and like the acronym FAST, timing of the time of presentation, to be able to reverse the effects and prevent permanent damage to the person's brain and the person's life. So for you to remember again, facial dropping, the A is arm weakness, the S is speech difficulty, and T is for time to take the person to the hospital, or if you live in a place whereby they have ambulance or services that you could transport the person to hospital. Like now, let's talk, because it's alarming, like you said, noticing that when young people be like, oh, I don't check my blood pressure regularly,
and people
because
think
I'm young,
elderly, it is a disease of the elderly.
Yeah. So
and now our research has told us otherwise, that even more young people are dying from it and suffering from it.
Yeah, so let's talk about it now, because there's a lot of factors that could lead to this. And when you started introducing what stroke is, you mentioned some of the things. The thing I noticed, like you hammered on, or we've been hammering on from our first episode, is untreated hypertension. Stroke has different factors, but do you want to elaborate and educate people more on
the untreated hypertension?
Yes.
So now if you go back to watch the first episode, like I've talked about, and you would notice that tertiary classification of hypertension, the stage 3, is one where the pressure is so high. Now it may be difficult to treat. Now imagine somebody who is not even treating at all. There is a pipe within the house. I love pipeline a lot. Taiwo knows. I mean, he's already laughing. Our fathers in the house, they like to check the pipe within the house, the valves that we control the faucet with, and then you notice that the pipe is already, like, it's been goggling since, and then you know that at some point this would burst. We all know. Our heart is telling us something. Like maybe sometimes people would get symptoms at this point. People will say they don't have symptoms. I think they must have ignored them. You are getting palpitations sometimes, or some people would say the pulse on their wrist, we call this radial pulse, is pulsating too much, or they can feel their own heart beating. Those are the symptoms of when hypertension is high, and they left it untreated. So at some point, these vessels are hardened, or the artery, to say is they are hardened, which could cause blood not being transported to where the heart needs it. And then as a result, the person just into the brain, you are not getting enough blood, leading to ischemia, or the pressure is too much that causes the artery to burst as a result of the high pressure. So as we can see, it's really, really a big deal when this thing is not being treated.
It's a big deal, and like you were saying from the previous episode, it's been found like in Nigeria,
Yeah.
89% the cause of stroke, one of the risk factor, 89% is due to untreated hypertension.
Yes.
And if you've not watched the first episode on hypertension,
You have to go back
this
to
is your
it.
key to watch it and educate yourself.
Yeah.
And now we started talking about complications of what untreated hypertension or malignant hypertension is going to cause. Another thing,
The word malignant, maybe some people don't know. Let me borrow you simple English. Malignant is when something has become hard to cure, hard to treat. It's become like a pest.
yeah,
So you've just been sending it away and it's not leaving.
yeah, definitely. Another thing is, like I was saying earlier on before we started talking about the risk factors, is smoking and alcohol use. Everybody think it's the social norm now.
Yeah.
And everybody be like myself now, a while back when I stopped drinking, and people are like, oh, pastor is a pastor now, or is a what, because he's become a nurse, he does not drink, he doesn't do all these other things again. I know a lot of people, you say, oh, healthcare workers, they are the worst people, they will tell you not to do something.
And they do.
Meanwhile, they do, but it's not all of us though. It's a certain percentage. And like we said, people deal with stress in whatever way. But you going into unhealthy habits, and like we said, you educate people today and you're not taking your own advice. So that's what got me into thinking that I need to stop drinking and doing all this on healthy habits. So smoking and alcohol use, smoking, people use they start injecting themselves now. Not only smoking and alcohol use, substance abuse of whatever way, it's put pressure on your heart. Some of them are uppers. When we say uppers, there are things that like make you happy, always walking around. It releases, dopamine now?
Dopamine
into your body.
And the heart, it wants to be exercised at the same time, it needs its rest.
Yes.
It is not jack of all trade, and for every up, there should be a down. And then to liken the risk factor of alcohol and some substance abuse with smoking to a research within the UK, I would use that as a comparison because the highest population of the young people generation that smokes and take alcohol now are found to do them from peer pressure.
Yeah.
From just the need to belong. Where can you make the best of friends? The pub. Where can you socialize and feel like yourself and not feel neglected and not feel depressed? The pub. You would see people that when you drink, the way these things are, built, the substance, they're meant to release the dopamine, which is known to cause the happy
Effect.
itch. So the happy ick. And then you just see people always happy in the pub. And when you see a happy scenario, of course, you want to be in a happy situation all the time. And before you know it, by hanging out, you also get immersed into that same lifestyle. And then another thing is children that go to school, they also want to make friends. They want to belong. And then let's hang out. You see your friends smoking today. And then before you know it, you see like yourself being the odd one out. Then by the third, fifth time, you're also trying the same thing. And from there, addiction is setting in. So
the internet, there's a lot of things you as a parent, if you try to prevent among your children, the internet, you see a lot of things on the internet, people smoking and drinking, having the best time of their life. Most of what they don't communicate to you is the long-term effect. If you notice, there's been a long trend of people coming down with complications from substance abuse. Some people go mad. Some people have kidney issues, lung issues, cancer, and a lot of other things that I won't be getting into this episode. So this causes effect on the heart, and a lot of these things, they constrict the arteries, which in turn increase the
cardiac output.
The blood pressure that we spoke about. So once your blood pressure is increased, and when you do these things over time for a long time, the pressure in your body increases. Your heart is made to do extra work, and it keeps doing that. That leads to long-term effects, and it could lead to the starvation of the brain not getting enough blood supply, and or cause the pipe to burst. Like we said, when something is narrow, something that was big before, it suddenly shrinks, and becomes narrow. Something has been taking the capacity of this, then suddenly becomes this. Where do you think the remaining pressure goes? It just tries to force its way. So, and the artists who are working, then once there's like a deep in that, when the brain is getting blood from this much before, it suddenly becomes this. So that will lead to ischemic stroke. And when the body is the heart is trying to compensate, the brain is telling the heart, I need more blood, I need more blood, I need more nutrient. And the heart is working overtime to pump more. Once the pressure becomes a lot, wow, like Oinda talks about pipe. It's just burst.
That representation of it.
It's everywhere, yeah. So imagine blood inside your brain, like all over everywhere. So it's just like pipe busting. Your whole house is filled with
and the head feels too heavy to be carried.
Yeah. Another thing.
So we are just also going to talk about something we look over a lot in our community, which is diabetes.
Yeah.
And
before you go on,
yeah.
When we're doing the hypertension episode, we talked about statistics and a lot of diseases that affect different ethnic groups.
Yes.
Most of these things we'll start talking about affects Black people in majority.
Mm-hmm.
These diabetes you just mentioned is one of the diseases that affect Black people.
And I think we should also reflect and then shed more light on this in another episode too.
Yes.
So now diabetes, as we talk about, I will just be very brief, and how diabetes and high cholesterol. So cholesterol is something many people are not familiar with. Cholesterol, let's use it as fat.
Yes.
In simple English. So diabetes, as people know it, is high blood sugar. So what people would be thinking, why would high blood sugar within the brain within the body cause the brain to malfunction? It's the same thing when we are short on sugar. Let's use that example. People say, oh, I can't think very clearly. I think I'm short on sugar. For you to know how important sugar is within the system. Now, what happens when the sugar is too much? And then when Taiwo was talking about the brain, and then in relation to stroke earlier, we say the brain needs nutrients. Glucose is part of the things the brain needs. Well, now when there is too much deposition of this glucose within the bloodstream, it gets carried away to every part of the body and, of course, the brain. Diabetes is has many complications. We'll talk about them in a while, but what we are focusing now is the stroke. When there is like accumulation of glucose within the brain, it's just like overexcitement. And then instead of the brain getting the oxygen it needs, in this case, it is getting more of glucose, more fructose or galactose, whatever is being deposited on the brain. Now, for the high cholesterol, the high fat. So now we may be surprised that we would think, oh, people who are on the overweight side would be the people who will be suffering from this. But that's a myth that we believe in our society. As far as I'm concerned, and every studies that have been conducted, people, either you are small or you are fat, to use that word, or you are overweight, you are bound to get an high cholesterol. And that happens when there is fat deposition along the arterial wall. Remember again from our previous episode, you may want to go back and learn. We have the veins and the arteries that carry blood into the heart and away from the heart. When there is fat deposition in these arteries, where we need them to be patent, not to be blocked. So eventually you have this thinning off or away the arteries, and then there's no enough blood to the brain, or the pressure becomes too much for the arteries on the brain, and then at some point we don't have enough oxygen, which is the ischemia, or the pipe just burst again, hemorrhagic. So I have a co-worker who was telling me about something recently that I may be surprised that people are so neglecting of their health in Nigeria, so much that an example, he had diabetes and then he lost his 2 legs from the complication of untreated diabetes. Yeah. This person was diagnosed earlier. He could have prevented it, but despite education, this person went back to his lifestyle of drinking alcohol, of unbalanced or poor diet. Maybe we'll talk about diet in a minute. And then when this person was admitted again to the hospital for follow-up and counseling, the person's statement was, well, I've lost both legs, so what more could I lose? it's death. You either lose your brain function, and which is like suffering until death, or the other two arms get taken away by being cut off. Or the person does just die immediately, and you think, oh, it was just fine. It wasn't.
Yeah.
These are the things. Do we have more things to talk about?
I think just talk over the last two things we've got. Another thing that's been trending up, it's HIV. Most people think, oh, HIV, it's not popular anymore. There's still HIV. A lot of people are walking around.
Yeah.
Thanks to modern medicine that helps manage the viral load. But people still like, a lot of people, I'm not nagging on anybody having sex or, but one thing we encourage, if you can't practice abstinence, is to have protected sex, whereby to prevent you contacting some sexual transmitted diseases that are not responsive to medication. They cannot be managed, but you have them for life. So let me not digress. Let me just talk about HIV. HIV causes a lot of complications if you are not compliant with your medication. Some people even have HIV. They have HIV and they don't even know. So
one thing the virus do is they destroy most of the cells and tissues. And then on our brain, we've got cells and tissues. So if the HIV you think is just within the blood, no, it is destroying some cells. It could even be cells within the kidney, it could be cells within the liver, but in this case, it is the cells and tissues of the brain.
Yeah, so that's another thing. People need to regular testing to know their HIV status. If you are sexually active, which we normally practice, we encourage abstinence if you are not married to prevent having multiple sexual partners and contracting this. We could talk about this more in another episode, talking about sex and sexual health. And the last
something
thing
I'm very, very much interested in.
We've noticed a lot of people having conversation about that, and it's been trending on social media. So
and then people are not shy to discuss these things. So it is. I think that now is the time to hone in on it.
Yes.
So
would educate people. Just be on the lookout for the notification. Turn on your notifications to receive messages about new episodes being dropped. So the last thing we'll talk about is the sedentary lifestyle and poor diet. Everything, most of these things are preventable. We've told you, most of these things are preventable and manageable with your diet and exercise. Diet and exercise improves your life and the probability of you contracting all these non-communicable diseases. It reduces it. It prevents you. It might not eliminate it completely, but it prevents, for most part, from you being just a number, where adamant about you just being a number, you becoming just a number. It's not good for you, it's not good for your family, not good for your society. So you not doing any exercise, we've talked about this in hypertension, but I'm on again. Not sleeping well, or working, going to work 5 a.m, coming back home 12 a.m, 1 a.m, then you're out again once it's 5 a.m. This is not good for your body. Your body needs rest. There's a lot of waste being accumulated in your body that needs to be washed away, and your organs, your vital organs, they also need rest. They need to be rested for them to function optimally. Your brain rests, your heart, they rest when you're sleeping. All of these things rest, and the waste are being excreted from the body to when they are at rest, they like function more when they are well rested and there's no waste in them. So another thing is diet. You eating, like the example we give, and if you
talked about what modification and combination of food can be maintained in our society, that we don't have to outsource exorbitantly, and we may be wondering how diet could contribute to somebody getting stroke. So earlier on we talked about diabetes and cholesterol, everything that has to do with glucose and then fat. What are you consuming? If they are being broken down by the liver, what eventually gets stored? If they're being metabolized by the kidney or the liver, what is being stored within the cells and tissues of the body? Do you get more fat than any other part of the classifications of foods? which would result into the arteries thinning out, or do you get more glucose stored that you don't need, which may be transported into other cells and tissues and may damage them. So, and then the inactivity, again, you can be small, you can be thin, you can be lanky, and then again be inactive because the muscles are not being exercised, the muscles are not burning. It's because muscles are built to be exercised for them to burn and then to, recalcify, to regenerate. So now when this thing is not happening, it's just like storing excess energy, excess fat that you don't need. Of course, it would go somewhere else that can accommodate it, because the brain would not send the fat away if it gets attached to that part. It has enough room. It's just too much of it there causes problem.
Yeah.
So I just think,
like you were saying, it gets stored in, like the part we were telling you about, it gets stored in the arteries, and the artery would not be able to like force the blood out. So it's like, how do I put it now? You flushing, maybe like, what can I explain? Probably like a sanitary pad. You flushing a sanitary pad, and it start clogging up.
You know, I see a lot of Lagos video showing people to flush that they could flush what is it called, condom down the WC, and even diaper, exactly the same thing. If it goes today, if it goes tomorrow, in a month's time, the whole thing will clog.
Yeah,
it's exactly the same
stroke. Yeah,
exactly. And then I think people need to remember that the signs of stroke that we explained earlier, the fast delay is, in this case, denial.
Only 17% come to the hospital.
Yeah, come to the hospital within 6 hours. And if the rest of these people, 83%, do not present to the hospital, the person either gets lifetime of chronic complications or they die.
So after all said and done about risk factors, causes, I think we should talk about how to what we can do to prevent, or maybe if the person has got stroke, what we can do to manage it. And the good, and like we say, most of these non-communicable diseases, when we say non-communicable disease, we mean disease that cannot
be contracted from one person to another. Yeah.
We know genetics play a major role, but you don't get it directly from, it's like you having it, this thing in your body is there, but
you can prevent it if you do the right practice.
So things that we could do, we said blood pressure, which is the most important thing, and we've said is largely manageable and preventable. Stroke is a complication, so it does not mean it's a disease itself. It's in its own right, it's a disease, but it's a complication that arises from you not managing your health better and not taking care of yourself. Your checking your blood pressure goes in a long way to prevent some of these diseases. And when you know your blood pressure, once the blood pressure we've sent out at the normal, the stages of sent out, you could look at it and reference from time to time, maybe every month, when like set aside. There are a lot of people that walk around with blood pressure machine. There are a lot of people that walk around in the market, they will work in the market, and people that work in corporate world, there are a lot of pharmacies around that you could check your blood pressure.
And I do think some workplace now arrange healthcare routine screening for their workers.
They even have centers, they have clinics.
Yeah, they do.
Whereby I could, from time to time,
if I work in a place with clinic, why wouldn't I go to the clinic? It's free of charge. Yet people stay away. I mean, I know somebody that says, why would I go to the hospital where they would tell me, where they would give me a problem?
Yeah, they'll be like, ignorance is bliss.
It is your problem.
They say ignorance is bliss. I just find out that saying ridiculous, because ignorance is not bliss. Like we are saying, hypertension doesn't show signs until the late stage.
Ignorance is silent death.
Yeah. So if you know where your blood pressure is, you know you're normal, you are active, you feel good. When you check your blood pressure, then you know that if it's beyond that or something is happening. Most of the time, it's not always like, oh, I've got hypertension, they will give me drug in hospital. Yeah. Most of the time, they just tell you make some lifestyle modifications and eat better and do a lot of things, conduct exercise. So another thing that they talk about is diet. We've said much about diet earlier, about what you eat more fruits, vegetables, whole grains like rice, If you like beans, if you like maize, you could either cook that, boil that. It's not every time you roast your maize, you could eat it while boiled.
And tailor your diet according to your pocket.
Yeah,
It
definitely.
can be achieved, most definitely.
There's a lot of information online whereby you could check and diet. About exercise. Exercise. There's this thing I saw about exercise recently. You know, someone was like, they know it's difficult. I was gonna leave this to the end, but they know it's difficult. Like exercise, you saying I want to use 1 hour in the gym today, or I want to do exercise for 30 minutes. They say it starts a long way by saying, while I do this, I will do this. So like maybe I'm in the bathroom now, you're brushing your teeth. While I brush my teeth, or after I brush my teeth, I'll do about 10 squats. So you squatting after brushing your teeth or during brushing your teeth.
It starts from somewhere.
Yeah.
Motivation starts from the littlest up to wherever your motivation reaches. I actually passionately would want to shed more light or to advocate people, advise people more on the use of the substance abuse and illicit drugs, smoke, and the act of alcoholism. So we know that we've pinpointed peer pressure being a very major cankerworm in this regard. I am not a perfect human myself, but how do I advise somebody who is being immersed into this life of using illicit drug to move away from them? You said you did earlier. So I would say
alcohol, no, I don't use drugs.
Alcohol. So everything boils down to mindset, changing environment, changing the friends you roll with. Even if you still maintain this environment and the friendship, you can be who you are. If these people are your friend, they would accept you for who you are. You cannot be committing a life of danger to your health, living a life of fullness now to live a life of scarcity in the end. I mean, everything about life has to do with what would happen later in life. But I think younger people now, I'm also young, they believe that what is tomorrow even promised.
Yeah.
Tomorrow is not promised, but we could hope to live longer. So now what if you are blessed with a longer life, and instead of you enjoying your old age, touring cities, looking healthy with enough muscle mass for you to do these fun things, and you end up on the sick bed? I mean, it would be very sad. It is just not difficult on yourself. It is difficult on people who care for you, who love you. And it is even too expensive for Nigeria to manage. Very, very expensive for your family to support. Now imagine working all your service years and then you retire and you are using all your money to care for one illness that was end as a result of ignorance. I mean, naturally, this is just a place where we try to be vulnerable, where we try to, show empathy.
Yeah.
I know many people are trying to stop these things, but they are finding it very difficult. In my own little way, I'm cheering you on.
So we've come to the part of the episode, the segment, what we call Real Talk. We've said everything, through numbers at you, said a lot of medical things, educated you, what you can do, what causes stroke. Now is the time where we talk to you. Stroke doesn't just affect your body. It affects you, your family, your finances, and your future. Especially when you're a young person.
I think there's one thing we forgot to talk about. When the neurons are not working, there's something we call pain. This pain is neuropathic. And even it's not just pain that you are saying, oh, it's painful. That you are not feeling anything on the leg. You've lost the sensation of pain. It's still painful. You remember we just said this thing is a neurological deficit. You are feeling the conductions that should have happened, which is happening against resistance. And then again,
she's saying a lot of medical
jargons. So I think another thing is the pain might not even be pain from the physical pain from the adino.
Yeah.
Adino.
The regret.
Why is this happening to me?
Yeah, those are the complications. Like example of what she was saying was that I'm sure you've seen a lot of people that they probably cut their leg or cut their hand, but they feel their brain tells them it's there. Like it's
Phantom.
there, they call it phantom pain, of them feeling like it's there. So it's exactly the same thing with them being paralyzed, but still they feel pain from there. The body still thinks it's there, but it's not responding.
Then
it's
a lifetime medication, which could cause some organs damage.
Yeah, and that's another complication that could lead to. And what I was talking about earlier on was about it's a joy stealer. It steals, if you're a young person, it steals your most productive years. Like could have worked and enjoyed and amassed wealth. We all want to amass wealth.
And the shine may never be
The same.
Yeah, it may even never be switched back on again.
No.
Never.
And if you're old, the old age where you're supposed to enjoy your retirement, enjoy your funds, just kick back and relax, you are spending in and out of the hospital dealing with one complication or the other. Our message to the government is we need more staffs, more funding, more stroke units, more rapid medical services, ambulances.
And if they could show a little bit of compassion to their fellow Nigerians.
Yeah. And our message to you that are watching, you in particular, take charge of your health. We need you to take charge of your health. In Yoruba, there's something they say, Ilera Loro, your health is wealth. You might not be the richest person, but you being healthy saves the money you spend in the hospital. I know most people don't want to go to hospital because they don't want to spend money. So preventing you from spending a lot of money, and healthcare in Nigeria is not free. So spending a lot of money where you could have taken preventive actions rather than curative or palliative actions. So this is our message to you, and we are signing off now. We're going to end the podcast there.
Taiwo, do you think from our last podcast, people said we mentioned something about hypertension and hypotension, but everything we talked about was just hypertension and not the hypotensive part?
I think we should probably just get their understanding. Probably they go a lot of things. In health education, we are always encouraged to gauge knowledge of the person you are health educating before you educate them. Before you educate them, gauge the level of knowledge.
Yeah.
So I think we should probably pull a poll out and see what people know about.
And this is the place or the situation where people educate us instead of us being educated.
Oh, yeah.
So we leave people to tell us everything they know about hypertension, and then you should divulge the knowledge of hypertension that you've learned previously. This is like poles apart.
No.
So every positive there is a negative. Try to think of the opposite of the hypertension. If you're right, we'll let you know. If it is the other way around, we'll educate you more. And then thanks for listening to the Vital Signs on this week episode. And then again, if this is beneficial to you, if you have family members who have suffered or who are suffering or who are at the potential of suffering from this, do not forget to share it to them, tell them, and then also involve them in this podcast and tell them it is a necessity that they join the family.
Yeah, you might just save your life, you don't know, by sharing. Stay informed, stay empowered, and remember,
your health is your future. Thank you.